All right, there we go. Good evening, Democrats. My name is Mark Gonzalez, and I'm chairman of the Los Angeles County Democratic Party. I want to thank you all so much for taking time. Taking time out of your evening to be here with us to discuss some of the most pressing issues our local electeds are facing today and how our city and county are working together to address them. Over the past several months, we have been holding town halls with some of our regional central committee leaders, and one of the most common suggestions and requests was to really dive into how the county and the city operate, both separately and how they can tackle issues together as well. This last year has created a countrywide conversation on a variety of issues. Everything from criminal justice and police reform to affordable housing and the homelessness crisis, to how to respond to issues ranging from business closures to healthcare, all in the wake of the pandemic. I don't need to explain to you all how this pandemic has put an unprecedented strain on families, workers, renters, school systems, and businesses. Tonight, to discuss how our city and county work hand in hand to help us move forward, we are privileged to have two local electeds leading the way, two strong, fierce Latinas leading the way. Join us tonight is Supervisor Hilda Solis, who's also the board chair and former labor secretary, and LA City Council President Nury Martinez. Now, without further ado, I'd like to introduce our moderators, Olivia Lee and Shetarrah Byfield. Shetarrah has been a community activist in LA County for the past 3 years, specializing in community outreach with an emphasis on encouraging youth and people of color to use their voices and mobilize in their community. Olivia has over 20 years of experience in community engagement and political activism at federal, state, and local levels. She is currently serving as our very own LACDP's recording secretary, and she's also the first AAPI countywide officer and the youngest person to serve in this role. Olivia, Shetarrah, take it away.
Thank you so much, Mark. Good evening, everyone. We are so excited to be here today to host this forum. As young Democrats, we've been here to support and do the work to uplift our communities here in Los Angeles. I'd like to welcome LA County Board of Supervisors Chair and former U.S. Labor Secretary Hilda Solis. Supervisor Solis has focused on combating homelessness and building affordable housing, expanding county services to all residents, increasing healthcare access, and criminal justice reform. Her accomplishments in LA County are wide-ranging. She worked with Mayor Garcetti to create a $10 million LA Justice Fund for undocumented immigrants, spearheaded the county's homeless prevention initiative in 2019, supported community-based systems of care to prevent incarceration of at-risk populations, and is instrumental in leading our COVID-19 vaccination program. I'm honored to have her as my supervisor in District 1.
Thank you so much, Olivia. We value these important conversations with our leaders, especially these two powerful women of color. We hope these discussions encourage our youth activists to get more involved and run for office. I'm honored to welcome LA City Council President Martinez. Council President Martinez has allocated hundreds of millions of dollars in federal CARES Act funding to help support small businesses and Angelenos with rent, childcare, and utility bills. She's spearheaded a plethora of other initiatives, including the Valley Bureau Human Trafficking Task Force, putting forth a plan to help protect the Sepulveda Basin, organizing the Valley Pride event, and funding the new and modern Fire Station 39 in Van Nuys. So I'd like to just get right into these questions tonight. This is directed to both of you. Can you please describe the relationship between the city and the County of Los Angeles, and what each side is responsible for?
Why don't we give the supervisor that question first?
Sure, thank you so much. I want to thank Olivia, Shetarrah, Mark, and everyone that's on, and also recognize the President and Councilwoman Nury Martinez. Thank you so much for hosting us tonight. It's a pleasure to be able to talk to you very frankly about what's happening with LA County and the city of Los Angeles. I'm very proud of the fact that in the last few years, there's been a dramatic change in terms of the leadership at the LA County Board of Supervisors. And part of it has to do with electing more progressive members and women. We now have 5 women for the first time in over 100 years that we're now on the board. And each of us brings different distinct talents and skills. But I will tell you that it has been, for me, the last 4 years, a delight. I've seen so much dramatic change happening with our relationship with the city, especially with respect to homelessness, addressing that issue, putting money in, collaborating. The city passed their initiatives. We passed Measure H that provides $355 million for 10 years. That's to provide the wraparound services and to work jointly in securing interim housing, permanent housing, and securing vouchers and the needed case management that's required. As of late, I just want to mention this. We are opening up a facility for the first time. We used our CARES Act money, $43 million and $6 million of my own discretionary fund to open up a facility on Vignes parking lot where the Men's Central Jail is adjacent to that. We were using that as a holding staging area if they were going to eventually rebuild the jail. We said, nope, no jail. I'm going to use that property to build 232 beds for interim housing. We did it with the city, working collaboratively also with council member Kevin De Leon was brought in at the end because he just got elected. And we said, look, this is in your area. Let's work together. Let's use the monies that the county has already set aside. You guys can do the maintenance of it, the actual services that will be provided, but we secured the facility. First time, record breaking for the county to have something built so quickly in 6 months. But that's just one. We've been doing a lot with vaccinations, rolling out primarily we started at Cal State LA, doing a lot of things, not just with the mayor, but with our other councilmatic districts, trying to really make sure that people of color, that we use equity as our vision. That has to be the reality, going to the places where people have a hard time getting vaccinated. You can't just expect people to go to Dodger Stadium, the Fairplex, or Inglewood Forum. We had to mobilize and get our Department of Public Health working with the city, with other providers like Curative, all these other providers that have been working with the city and with us to get out there. So right now we have about 500 providers that are really working closely to help reflect our community in terms of making sure that we have people on the ground that speak the language, that understand how to get to our community. Aside from that, we've been doing so much in terms of room key, home key, purchasing and leasing hotels. We've done that in the city of LA, but also in my district, which spans all the way to Claremont, Pomona, all the way up to Atwater, Silver Lake, and LaSalle, and to Southeast communities. So I'm very proud of the fact that we've been able to work with our council members. And also Nury and I, we talk when we can about metro issues, which are going to be very critical, opening up rail lines, bus service, restoring that, and hopefully making it more accountable and safe for the people who ride. The majority of people are women, people of color, they're low income. Their annual income average is about $18,000 a year. So if you can imagine, we can make it safe for them, clean, protect them, allow for more the recovery to occur, get people where they need to go. And investments, I applaud Nury for what she's doing with small businesses. I too have tried to do what I could with our CARES Act money, and we're going to keep doing as much as we can. Too many mom and pop stores and restaurants have gone under. We've got to get to them. And many of them were not eligible because they're undocumented to receive this special funding. So we secured additional resources to provide technical assistance so that they could apply and know that nobody was going to turn their information over to reckless agencies that would hurt them. And we're going to keep doing that. The latest thing I want to say, though, that's really interesting is we were approached by the White House to help out with the unaccompanied minors. And just today I announced, because I was asked about it, opening up the Fairplex and using our assets to help provide the sufficient housing with HHS and our new Secretary of HHS, who's Javier Becerra, as well as FEMA, to provide hopefully stand-up assistance for maybe 1,500 to 2,000 children who are from Central America, Mexico, and otherwise. And we would do it in a holistic manner. And I'm looking forward to working with the city on all of this, because many of the families live in LA City, that we will reunite with these children. And so we're going to need to have a call out, Nury, you know this, to get people to be guardians, taking over as foster parents, but also helping to identify how we can unite these children with their families. Thank you.
Such an important topic. And Councilmember President Martinez, if you want to kind of answer that question as well.
Yeah, so just so that we are clear, I think it's so important. First of all, thank you for allowing me to share this time with you. And it's a pleasure to be on here with Hilda. I think that over the last couple of years, when women are at the helm, we tend to reach out more. And there seems to be a synergy of wanting to work together and get to common ground because we want to actually help people. And so it's kind of enlightening and kind of refreshing for me. When Hilda became board chair, the first thing she did was reach out to me in my office. And I think our staffs were really, really well together, Hilda, on depending on what the issue was, but we seem to be really in sync with what we're trying to get done. And just so that we are clear about the different roles of the city and the county, you know, our responsibility is to ensure that your lights are on, that your streets are paved, that your water is running, that there's electricity, that your trash is getting picked up, and that your sidewalks are safe. I mean, that's at the core of the city's responsibility, including rec and parks and libraries and LAPD. I think that one of the most important things that Hilda and I have actually brought up every time we either in front of at a press conference with the mayor or with the governor is this issue of equity when it comes to COVID testing and vaccine distribution. And it's one of the things that I applaud Hilda for doing because we got on the same page immediately. We saw the rollout of the testing sites and how that was being disproportionately, our folks were not accessing those testing facilities as soon as possible. And our communities, her district as well as mine, have seen the results of what this pandemic has done. It unequivocally has put people of color at disproportionately at some outrageous rates in terms of their exposure and their infection rate. We've advocated to make sure that when this vaccine got rolled out, that it was our communities and communities of color who had been hit the hardest, that we have access to these vaccines. I think you and I, Hilda, have been very frustrated with what's happened, whether it be how our folks access appointments online or whether it's tackling these vaccine chasers that were coming into our neighborhoods and really making it difficult for the people who were intending to vaccinate to have access to the vaccine. So Hilda and I have a very unique and very respectful relationship because I think we come from the same place, right, Hilda? We come from immigrant background, we come from representing communities of color, and we're not shy about advocating for our neighborhoods and our districts. And I think that the vaccine rollout, how we've been able to work together, and the county has partnered with us to use some of our city facilities to roll out some of the first initial vaccine sites. I think you helping our fire department, making sure there's the distribution centers and the mobile clinics are working in the hardest hit communities. You've been very instrumental in doing that. And I think you just touched on the homeless issue. And that is the issue of the day, every single day, making sure that the city does its part of building the beds, whether it be temporary or permanent housing, and that the county comes in with the social services and the mental health services to be able to get people off the street. And so her and I have a good working relationship. I'm just really proud of all the women that sit on that board. And I think we just have a different take and a sense of urgency to try to get things done today and not continue to kick the can down the road.
Mm-hmm. Thank you. Awesome. Mm-hmm.
Thank you both so much for those answers. This is a perfect segue into our next question. LA County is the largest and one of the most diverse areas in the US. However, we have seen a drastic rise in homelessness amongst people of color in this county. During the pandemic, what are some of the ways the city and the county is specifically working to make sure this growing group of homeless folks' needs are addressed? And Council President, if you could answer that one first.
Well, I think this crisis we're in now is a result of decades of bad policy, of NIMBYism, and the lack of resources for communities of color. The homeless count showed 65% of homeless people are in LA County. In the city of Los Angeles, I want to say it's about 41,000 people. But we can't ignore the racial disparities in the homeless crisis. When Black people are 8% of the population, but make up 34% of the people experiencing homelessness, that's a huge crisis and a huge disparity. Combined with Black people, Latinos make up 70% of the people who are living on the streets. So it's important to frame this discussion with real facts. The city's primary responsibility when it comes to homelessness is to build housing and build it as fast as we can. I think over the decades, the city has ramped up its efforts to build housing and beds and get as many people as we can housed and off the street. And the goal is to permanently house them in permanent housing. But I just, Hilda, you talked about a little bit about this, what the county is doing, but in addition to that, the city has approximately put almost $100 million that we've committed every year to this homeless effort. And last year during the CARES Act money, the first round that we got back in April and May, we allocated about $200 million towards this effort. So in 2020 alone, we allocated almost $445 million between the federal and the state money, on top of the $100 million that we had committed annually from our city budget. So the resources that it's going to take to actually build the housing cheaper and faster, we're going to need more help. But I think that, we've been trying as much as we can to work closely with the county to make sure that the services and the operation of the unhoused communities' needs are being delivered. And that's something that we need to be more transparent and more accountable to. And we need to ensure that those resources go hand in hand with the beds, that the services and the mental health services are also aligned. Our HHH bond that we passed several years ago, that amounted to $1.2 billion. We're getting close to 7,400 units of housing to date. The bridge home sites that you see throughout our districts, we committed to building at least one in each council district. And so far we've built 28 of these facilities, and we're developing, that developed almost 2,000 or 2,100 beds. That's an investment of almost $147 million. But doing this, we also have to have, services attached to this. This is why it's so important to continue to work with the county. Hilda, you talked about Project Room Key. We now have secured 24 hotels and motels. That's almost 2,400 rooms county-wide is the last count that I got. I don't know if you have any different numbers. And Home Key, money that we also use CARE money to do this as well through the state, that purchased about 18 hotels and motels and commercial property, almost adding to almost 1,100 beds on top of the 2,400 beds from Project Room. This is all very complicated, but nevertheless, I think between the federal dollars and the state dollars, Hilda, we've been able to put that together and secure hotel rooms for the unhoused, as well as actually purchasing buildings themselves.
Right. That's awesome. Yeah. No, and I really want to thank you, council member and president of the council, because it really does take someone who has determination to get this done. And you and I have talked always about how it's really difficult to get some of areas in the city and the county to step up to the plate. The need is so great, but there's still this NIMBYism that goes on where people are saying, well, we don't want it in our backyard. It's your problem. It's your people. Send it over there. And we're like, no, this is about justice. And we have to be more equitable and use that equity lens no matter where we go. And I have been working really hard along with my colleagues on the board to try to develop more housing opportunities. In fact, a couple of years ago, because there's hardly anything in the other part of the district that I represent in the San Gabriel Valley, we don't have the same infrastructure that LA City has, because it's primarily concentrated around Skid Row, Venice, and other areas. And there's never been that full bounty of support in the same way spread throughout my district, which means East LA, Southeast LA, and the San Gabriel Valley all the way to Pomona. The highest poverty rates there as well. And people, we had to kind of, how could I say, really try to break down these stereotypes, because homeless all don't just come from Skid Row. They come from our communities. They're Latino, they're African American, they're Asian, they're widows, they're young people, young men and women, people that lost their jobs, people fell out of bad luck, substance abuse, mental health, maybe a widow lost everything and ended up on the street. So I've seen so much disparity, and I want to continue to just emphasize that we still have to work together. The city's doing a better job, but we need to do more because we have this now court authority overseeing us. Judge Carter has come down because there's been a lawsuit against the county and the city saying you guys are not doing enough to get people off the streets. You need to put them in shelter, whatever that might mean. So we're working that out right now, and I'm happy to work with Nury, with you, and with the other council members to see how we can better address that by acquiring more hotels, leasing them, buying them, making permanent housing available. We're already doing some of that now with the city and also in the San Gabriel Valley. Just to give you an idea, we just picked up a hotel in Commerce and even in Baldwin Park. But I want to get more of our local elected officials. This is where the Democratic Party really has to stand up and help us get some of our elected officials that you all support, that are minority and otherwise, but are not understanding the urgency of moving forward and using their community development block grant money and CARES Act money to partner with the city of LA or partner with us when it's reasonable to help expand shelter for people. And for some reason, there's still that resistance. All I could say is, as a Democrat, I think we ought to all work together to help inform our new leaders. We have a lot of new Latino, African-American, women, API that are getting elected, but I'm not sure that they understand the urgency of now. And we can save lives. Part of the pandemic has caused us to really provide this shelter because so many could extend that the spread of the virus, but also be impacted because of their deaths. And that still is somewhat underreported. We still don't have all that data. That's something that we're going to have to work on. My whole thing is prevention, using our CARES Act money along with our Measure H money, as well as some of our money that we have with our housing funding that comes through DHS, Department of Health Services, which provides shelter also and ending recidivism for people who are homeless, that have substance abuse issues, mental health issues, and have criminal backgrounds that we know we can help and recuperate them and get them on their feet. And one thing that I'm really excited about that we're doing right now is close the jail down. Let's put people into housing, recuperative beds. And we're going to be doing this right now at LACUSC. 160 beds are going to be created there. Just last Friday, we did a groundbreaking, and that's part of the city of LA. LAC is in the city of LA. So we need to work together with the state elected officials, as well as with the city and others, so we can open up more opportunities and have these spread out throughout the city of LA, as well as the county. And I'm looking forward to that. And again, just emphasize that we're working collaboratively on this new venture. The first one is the Vignes Center. And I've also worked with other councilmanic district. Kern Price, we used Grand and Adams Avenue. We have the Hudson Clinic there. We're going to be repurposing that property. But while we're doing that, we're using the parking lot to provide shelter for 100 individuals, 50 are women, 50 are men. And I think you may have seen what that might look like. It looks like an inflatable bubble that is encapsulated, but it has showers. It has people get wraparound services. They get fed. And while we're looking to create more housing, this is a temporary way of helping them. So we're trying to populate that around the district, and we did it successfully in Pomona. Now Pomona actually has brick and mortar, and they're taking care of over 275 people there with wraparound services and working with our local providers. So I think that we're onto something here, and I'm excited to work with people like Nury and other partners in our county government that want to work with us. And we're here. We don't have all the answers, but we can work together to find those solutions. And I think that's what I want to bring to this discussion: the unity. There's more power when we work together. And I think
during the Alliance case, which we're currently in settlement negotiations, I mean, the 6,700 beds that we agreed to back in June to build, and the county was going to fund services for, that's in the works. We're going to meet that deadline by next week. So that's a good sign that those are beds that did not exist and exist now as a result of how this case is progressing. But I know you've been a huge strong supporter of making sure other municipalities are doing their fair share, because so much of what we feel in Los Angeles is that we are surrounded by other cities who are simply not doing their fair share and are possibly pushing their homeless issues into the city of Los Angeles. And I've got council members who that becomes very problematic for, like a Joe Buscaino, for Monica Rodriguez, and for other members whose districts abut another jurisdiction. But I also, in talking to Hilda and her addressing some of these municipalities in the San Gabriel Valley, we also cannot continue to put the burden on communities of color to solve the social issues of every single community. You cannot, in the Valley, it's Monica and I who share the responsibility of building the housing and the services that come along with it. The Valley is huge. There's almost 2 million people who live here, and we cannot always be the ones to shoulder that burden that I believe is a responsibility of each neighborhood and each councilman district to be able to do their share. And I think that over the last 3 years, I've been pushing for that equity lens to be looked into and to make sure that as we're building, that we're using that equity lens so that each community is doing their fair share, and you don't have 6 districts of color bearing the entire burden because no one else wants to build anything, because other communities have the political will and ability to turn up and shut down a homeless shelter from being built, or they have the political clout to get a hold of their council member and oppose a project. My folks are working every day. They're trying to figure out how to put in, food on the table, holding 2 or 3 jobs. I don't have time, Hilda, to show up to a meeting and yell and scream about opposing a project. And so these are the realities of the political world that we live in, and that stuff needs to be called out.
Yeah, you're right. And I think, again, it's incumbent upon us as a party. Democrats represent something, I hope. So let's make sure that everyone really understands that it's not somebody else's problem. And it's all about us helping each other and our families, our neighborhood, and our community. And it's true, I've shouldered a lot in my district. I've opened up places for home key, room key, shelters at one of our parks in Bassett. And I was called out by a lot of people. I was called out by even elected officials who are Latinos and people of color, and said, Hilda, how dare you want to open up something in my city? You're going to draw a magnet of homeless people here. And I'm saying, wait a minute, don't we all have an obligation to help provide shelter for people who come from your area, from your city? I had this issue with many of my cities. I represent 24 cities, aside from the city of LA. And I can tell you there are maybe just a handful that are saying, yes, Hilda, we'll work with you. Baldwin Park is one of them. Monterey Park, Pomona is one of them. We also worked with Commerce is helping us, and some other places, but we need much, much more. And the need is so high. We know we have over 66,000 on any given night that don't have a bed and shelter. And what's really hurtful, I think, for me, is knowing that there are mothers, single head of household moms, that are living with their kids in a car, and God forbid, on the street. And that came to light to me very early on, even before the pandemic, when I had some hospital, White Memorial, call my office and say, Supervisor, is there anything we can do to help these kids? We're getting calls from the teachers at an elementary school in East LA, and the children are coming in, they're not bathed, they don't have clothing, they're not eating. And we know that they're living in cars. We're being told this by their teachers. So they took them in, they helped to provide them support, but it didn't solve the problem. So we need to do more. And it can't just be shouldered by those of us that know what's right. It has to be a broader agenda and a bigger discussion. So I want to challenge our Democratic Party to do a better job and have maybe a scorecard of elected officials that you get in office. What are they doing? What's their agenda? What have they accomplished? And have they really collaborated and drawn down their money, whether it's community development block grants, discretionary money, CARES Act money, whatever it might be? How are they utilizing that? And maybe they can collectively work as a region to help expand homelessness so it won't just be burden on one area, but a region. And I kept bringing that up, but I'm not sure that a lot of folks are really hearing that. Nury, I don't know about you, but
yeah, and we need to stop. I don't need to hear from someone else who lives on the other side of the valley to try to come and tell me in my district what I need to do in regards with homelessness. How about you stay in your own neighborhood and you advocate to build homeless shelters in your neighborhood? How about that?
I think those are some really great points. And what I really appreciate is not just a challenge to our Democrats who are with us tonight and to the party of making sure that we're supporting our local Democratic Party elected officials so they can do the right thing in solving this issue together. But also what I really, really appreciate is how the two of you were able to string all these different issues together and how they're so interconnected, and especially how it impacts our communities of color and how we have been burdened with all of this for so long, and how hard the two of you are working to ensure that we can move in the right direction, especially out of a pandemic that we've had for the past year. So I really appreciate that response from both of you. And this is sort of really related to what we were just talking about, which is COVID and the pandemic that we're in. And I know that this was touched upon by both Supervisor Solis and Council President Martinez. So we do know that the pandemic has really hit our communities of color really hard, especially Black and Brown communities. And we also know that the governor has announced that all the restrictions on the vaccines are going to be lifted in a week, next Thursday. And so what are the actions that the county and the city are taking now to ensure that the hardest hit communities are still able to easily access the vaccine, especially as we're opening everything up and especially as we're moving down the tiers? So Supervisor Solis, do you want to kick us off on that one?
Yeah, I want to tell you, I'm really happy that our health officer, our director for Department of Public Health, Barbara Ferrer, has done a really good job in terms of helping us negotiate and really tell the state, wait a minute, you can't bring Blue Shield in here and expect us to turn everything over to them and people are going to go on my turn. If people don't even have access to the internet, or they don't have an automobile, or they have no transit ability to get to these megapods. So one of the things we decided early on was we had to go to the people. And one way of doing it was, after we opened up Cal State LA, working with FEMA and Cal OES, was to make sure the mobile units went directly to the hardest hit areas. So those 2 mobile units actually parked out at many of the high red flagged areas that we knew already by data where the highest COVID cases were. They were in East LA, Boyle Heights, and also the Southeast area. So we continue to work on that trajectory, and we continue to force the discussion that even though, for example, Cal State LA is going to be leaving in terms of FEMA, that the city of LA, the mayor, is going to get engaged. So now we're going to have a structure, but we want to make sure that we have enough vaccines to distribute. Problem is, I'll be very clear with you, is supply. We got a big supply this last 2 weeks. The first time, it's record history to get that, over 300 dosages per week. But now this next slew of vaccines that are going to come in, many of them, I'd say 80, maybe 70% will be dedicated for the second dose. The remainder of that 300,000, which is very small, 100,000, will be for first dose. That isn't enough. So on the one hand, we have the state and everyone saying, oh, we're going to be able to vaccinate everyone. Guess what? We have a supply issue. And let me just be even further clear.
Right.
In the county, we have 10 million people that live in the county. Only 5.5 million have been vaccinated. So that just tells us we're not done. And our community is still vulnerable. And there's 2 variants that are coming in very quickly. And we have a lot of young people that have not been vaccinated. So again, use your masks, use your distancing, use your head, and be careful who you align and what you do in terms of your personal activity. Doesn't mean just because the bars are opening up or you can go eat with people indoor that you have to do that, because this virus is still very heavily transmittable. Just by speaking in front of someone, even singing in front of someone, or sitting and having a meal. If you're not wearing your mask, more importantly, you can spread that virus. And many people, young people, I would say between the ages of, say, 20 and 39, are the ones that are asymptomatic. And they could be carriers of the virus. And I'm very, very concerned, because I would hate for us to have to draw back down on our health orders and pull things back. It's going to hurt essential workers. It's going to hurt our people of color. It's going to hurt our community harder than anyone else. And it isn't just Latino and Black, it's API. We have a lot of low income Asian community members. In fact, we're having to set up special vaccination sites in Chinatown because there are people there, elderly, that have no access. And because of the lack of communication in their culturally competent messaging, we're missing out on that. We're missing out on people that need this help. So I would just implore all of you to help get that message out. We're not out of the woods yet, and we don't need to go back to where we were in January, where our hospitalization rates were way up. And just think of what we're doing to our nursing and nursing health aides, everyone, our nurses, our doctors. If they get sick and they're worn out because they're trying to save lives, we're adding to the problem. So it's common sense. And I think we have to work together. And I've been happy to work with the city on a lot of these issues, and really want to applaud, Nury, you've been out there screaming, saying, come on, you guys need to be out here in San Fernando, Pacoima. And I agree with you. Just like I'm saying the same thing, East LA, Southeast LA, the highest rates of death, in fact, in my district, and COVID rates. And it isn't just, as I said, Latinx, it's also other people of color. And we cannot allow this to happen. We have to close that donut, because what we found during the pandemic is there's a donut and there's a big hole. Guess where the hole is? Where people of color and low-income people live. So we have to fix that. And now we have an opportunity to do it with some of the rescue funds that are going to be coming through, not just the state, but the federal government.
Absolutely. Thank you so much, Supervisor, especially for all those call outs. Council President, is there anything you want to add to that, to the question?
No, I couldn't agree with Hilda more. I think it is a supply issue, and I think we've been struggling with that, to have a steady supply issue. To be guaranteed how many actual doses we're going to get a week would help us plan a little bit better. And the distribution, the access to the vaccine is another major hurdle. Hilda, I don't know if you would agree that I don't think there's as much hesitancy in terms of taking the vaccine in our community. It's an access issue.
Yes.
It's like they need to know exactly where to go, and we need to make it as easy as possible for them to make an appointment and access the actual vaccine.
Mm-hmm.
I think our neighbors and family members understand the sense of urgency, because we're the ones dying. And so people, I know people have passed away. I know people have contracted COVID. I think we all can probably relate to that. But in my surrounding, in my neighborhood, I can tell you of families who've lost a father or a mother, or in some instances, even two parents. And so I think for us, it's just making sure that we have a steady supply. And that's something that Hilda and I have been communicating with the governor on. And also making sure that we have access to it, so our folks are not traveling to Dodger Stadium or Magic Mountain, which is where I took my mother, but that the local park has it every single day, Monday through Saturday. You go, you don't have to show up with an appointment. You can walk up, get the vaccine, get your card, and be on your way. And so that, I think, is what we need to push. Is if the vaccine comes into your neighborhood, you need to quickly go get the vaccine and spread the word, and let people know that it's here, that it's in Sun Valley, that it's in Arleta, that it's in Van Nuys, so that the people understand exactly where to go. Parks, the Ys, all those areas where people, churches, our local community clinics, these are all people, those are all places that our families trust, right, and are very familiar with.
Absolutely. Go ahead, Supervisor.
If I could add, I think one of the big issues that the pandemic has really exposed is the digital divide. We have many community members that have no access to internet. They can't afford it, or it's very limited. They use their cell phone as a way of communicating. And so we have to come up with non-traditional ways of reaching them. And it can't just happen through my turn. It's not working. We knew that it didn't work. So part of it is also contracting. The county is contracted with different CBOs, federally qualified clinics, to say, okay, we're going to give you 500 or 600 vaccines. Go to it. Get your clients that you work with originally. People know you in the community. Go walk the streets using our promotoras. Was able to secure $30 million to hire up promotoras, who are people from our neighborhood, women who could knock on doors, talk to people in their language, and really get the trust that's needed. And these are they're health navigators. And we can do it in the African-American community. We've been doing it. We can do it also in the API community. And we should be fearless about it. Because right now it's a matter of life and death. And people, I agree with you totally, Nury, that our community isn't afraid of getting the shot, getting the vaccine. It's more about where to go get it. And if you can do it on a telephone instead of maybe going on the internet, or having another CBO navigate that for you, chances are they're going to get right in the queue right away. And that's what we have to do. We have to simplify it.
Great. Thank you so much for that. Shetarrah, I think we're going into a couple of audience questions.
Yes, thank you both so much for those answers. I know these are very difficult answers, and not always a clear path to these, but I applaud both of you for your leadership and your communities. You're both women that I look up to, and I hope one day to do this sort of leadership in my own community. My first question is from the audience. Christian, he wants to know, how can we form better coalitions of labor and environmental justice groups? And Council President, if you want to start with that.
Yeah, I've been trying to do that for 2 decades now. So I never really considered myself an environmentalist. I think it grew out of necessity because I grew up across the street from a Superfund site. So growing up, Hilda, I don't know about you, but I didn't understand these chemical terms. And when we came down to trying to clean up the Superfund site, which was where my mother worked at for many, many years, we were met with like hundreds and hundreds of guys in suits who were attorneys representing the company. And so I think that I had to learn really quickly what that meant. And so sometimes we're at odds with trying to protect our health and also ensuring that the livelihood that people depend on, which are these jobs, are not at odds. And I think that's where we have to sort of figure out how to continue to make that connection, because so many times our families are dying from the very places that they work in. And so, and then at the same time, it's the only jobs that are available in our community. So for my mom, it was that plumbing manufacturing job that almost killed her, but killed a lot of the people that she worked with. And then they left a Superfund site. And when they went to Mexico in the 90s and left us a pile of junk for us to have to deal with. And so, you know, it's one of these things where I think that as we move forward with the so-called Green New Deal, that the focus that I've created in Los Angeles is that if those green jobs are going to come, they have to come to communities of color, because they're the ones who have historically bear the burden of dealing with these high polluting manufacturing facilities. We're the ones with the landfills in our neighborhoods. We're the ones with these high polluting manufacturing jobs of which our families depended on. And we're the ones with these polluting sites that were left behind. And so if we're going to talk about creating green jobs, I'm okay with that, and retraining some of our workforce. It needs to come to our communities. Sun Valley and Pacoima needs to be taken care of, because we have been inundated with freeways that surround our neighborhoods, with incompatible land use decisions that were made 50 years ago by predominantly men who didn't understand the implications that was going to have to communities of color who were raising kids across the street from these facilities. These are all things that have now come to some other communities that are alarmed by the climate change. We've been calling on climate change for almost 4 decades because we've seen what it's done to our neighborhoods. And so now that it's popular and it's mainstream and you've got young people talking about it, I grew up across the street from this junk. And I grew up across the street from having to breathe this toxicity every single day. And so I think that there is merit to that, but we need to advocate for these green jobs to come right here, not go into any other neighborhoods. We need to have first dibs on them, and we need to have workforce development and training for the very people that have been displaced and have been laid off as a result of these companies moving to another country. But more than anything, the communities that have suffered the burden of some of these polluting manufacturing companies.
Great.
Right.
Thank you. Supervisor, would you like to add anything to that?
Well, I think Nury's right on it. I mean, I kind of have a similar background. I grew up in unincorporated area of close to La Puente and Bassett and City of Industry. Industry had, as you know, one of the largest landfills known as the sanitation district, Puente Hills landfill, and also a battery recycling plant similar to Exide, where my father worked for 25 years. My father had, he worked there. And if you know anything about that industry, it's very toxic, it's very poisonous, it's very deadly. You might get paid well, but you may lose your life. You may contract cancer, tumors, all of that. In addition, whatever is spewed out in the air, as well as in the water system, can also impact surrounding neighborhoods. And I saw that happen around where we grew up, where families were coming up, all of a sudden, Latino families were showing up with tumors, cancer, and it wasn't hereditary. So you knew it had to do something with the environment. And so early on, when I ran for the state assembly back in 1992, a long time ago, these were issues that I cared about and continue to fight ahead in, because we still see the egregious behavior of some of our industries that are not abiding by our rules and regulations that are there in place. They're just not being enforced. And part of it has to do with who's in leadership, who runs these agencies that are supposed to regulate these industries. Right now we have Exide. Right now we're trying to solve an issue there that It's going to be very difficult. 10,000 people have been impacted by that plant, Exide, that had been allowed to operate for over 44 years with an illegal permit. Nobody really stood up to them. They got away with it. They went bankrupt and then they walked away from it. Now we're trying to recoup, and I doubt that we're going to get our money back in any way. The taxpayer is going to have to end up shouldering this, but we're going to have to try to clean up these households. And already we've cleaned up close to, I want to say almost not quite 3,000 out of 10,000, but gone in and tried to clean up their soil. Because think about it, if you're exposed to lead, a child, a mother that's pregnant, it doesn't go away. And people don't seem to understand the severity of that, and that we have multiple incidents in the community, people having cancer, tumors, and early, many have died very young at age. And we have large numbers of disability in terms of developmental disability with our children. And it's a wonder, because that's what lead poisoning does to you. And we have to do a better job. And that's why we also have to have elected officials that will stand up and speak out. I agree that we have to do more training in the green area. When I was Secretary of Labor, we spent a lot of money working with our community colleges, workforce training, getting our at-risk youth involved in helping us do solar installation. That's just one part of it. There's so many other aspects, even in transportation, getting our young people, especially our at-risk youth in our communities of color, into new technology. For example, batteries that are being used for electric buses and vehicles. And we have a program that I helped to fund with Shetarrah out in the City of Industry, with individuals that were at risk, adults and young men and women, to get into these jobs so that they can look at the future, not lose out on opportunities and good paying jobs, but also giving them a career path. And knowing also that we're going to have to do something in transforming the jobs that are what I would call the dirty jobs, like working in the refineries, oil industry, battery recycling, soldering, all of that. How do we transition these people into something better that's going to be healthy for them? And that's going to take an investment, partnerships with the federal government, state government, and using our workforce training dollars. And I'm a big advocate for that, because I know the difference that that could make, especially for our young people, and working with our community colleges and also universities. But I think for us, people of color, first stop in higher education is community college, and getting workforce dollars there to help pay for these programs and pay these young people to have at least a good starting salary, and then get into a career, not a job, but a career.
Thank you so much for that, for both of you. Especially, I'm an alumna of Mount SAC, so I really appreciate you sharing that. And I appreciate both of you sharing your backgrounds and how that has shaped your leadership style and why these issues are so important to you. So this is going to be our last audience question before we close out. So the question is, since the onset of the pandemic, we've seen a rise in anti-Asian hate crimes throughout the nation, and here in Los Angeles, with a 114% increase in hate crimes in LA in 2020, even as these crimes go underreported. What are the actions that the county and the city are taking to combat hate crimes against our communities of color, and what can we do to help amplify and support your work on this? So Supervisor, do you want to take that away?
Thank you. Well, you know, my district is very diverse. I said it from the beginning. Majority are Latinx, but I would say a good 25% or more. I think I represent the second largest API community in the county of Los Angeles. And I've always been proud to be there by our side, working hand in hand, because we have similar issues, discrimination and access, whether it's healthcare, whether it's economics, whether it's building your own business. People have roadblocks, and part of it is because of who they are and how our systems don't work in a multicultural environment. We have, for example, a Human Relations Commission that is run right now by Mr. Toma, who's API, wonderful gentleman, good guy, bringing up provocative types of programs so we could enforce anti-API hate crimes, reporting, data collection, and also looking forward, thinking forward how we can get our other departments to work alongside with us, not just one commission, but the entire departments that we oversee. So whether it's also working to make sure that reporting is happening, that there's counseling, there's mental health, and also a hotline that was developed. But we need to do more. We know at the national level now, we're going to work in concert with the federal government as well as with Congress to see how we can have better teeth and apply and prosecute people that discriminate against people who are different, and especially API community. I take it very seriously when I see women, Asian API women being assaulted and murdered. Look what happened. Oh my God, it's incredible. And you see it here in San Francisco and LA, and it's underreported. And I think that's the biggest myth, to try to break down those barriers and educate our community. You see something, report it. And we have a hotline, and you can go online, our LA County Human Relations Commission, to get that information. But it's not about hate. And the Trump administration did us no good deeds here, because now with the coronavirus, look at how many names they used associating Asians to the pandemic. How derogatory, how disgraceful. Now we have to repair that and bring people together. So I'm honored to represent a community here in the San Gabriel Valley, as well as Los Angeles. I represent Chinatown, Little Tokyo, and areas in the San Gabriel Valley, Monterey Park, where we call Monterey Park Little Taipei. And I'm very happy to work with our partners there. They've been working with us, all our community-based groups, CAUSE, EPCON, all of them, helping us take information about the vaccine, coronavirus, distributing masks, working in concert with our professionals in the API community who have partnered with us. So all I have to say are good things, and that we can't let the negative tear us down.
Thank you, Supervisor. And Council President, is there anything you want to add to that?
Yeah, Hilda, you've done an amazing job, and I think they should all be very proud of how you represented them and stood by our Asian brothers and sisters. But on the City Council, we've adopted a resolution to denounce these types of hate crimes, and also asking for data in real time in terms of how these crimes are actually escalating. But actually, more importantly, is are people even reporting these types of crimes? I think for some of our community members, especially our elders, they don't necessarily know how to do this, or they know that this is a crime. And so I think that's something that the Latino elder community can probably identify with some of our elders in the Asian American community as well. It's scary, right? I mean, they come to this country, they do everything right, they work really hard. And when these types of crimes occurred, I don't think that generation felt empowered to come forward with what's just happened to them. And so that, I think it's something that we're going to have to continue to talk about. I want to talk to some friends of mine that issue of this generational gap continues to come up. I think that back when our parents came to this country, I think we didn't speak up, right? You just did what you came here, you worked, you kept your head down, you kept law enforcement out of your business, and you raised your kids and sent them to school. And that's what you did. You mind your business. And I think that so much has I think my generation and younger generations, I think we're speaking out more against this type of crimes. And I blame the former president 100% on the rhetoric and social media for not denouncing and doing more to take some of this hate speech down. And I think it's atrocious. I hope that my child, younger kids are able to denounce this, to call it out immediately and stand up against this type of crime, because I know we were discriminated against when we were growing up. Our parents didn't do anything about it. You know, we did it. I mean, they made fun of us not speaking proper English. They made fun of us for having our accent. They made fun of us for our skin color, for being poor, for being Mexican, for being undocumented. I mean, we all know what that feels like, but we were not empowered necessarily by our parents to call that what it is, racist and hate. And I think we need to do a better job of instilling that in our children, because that is something that is taught. Children are not born to hate anyone. You instill that in your kids by how you act and how you treat other people. And so I hope that we can do a better job in denouncing, but I hold one person responsible, and that's Donald Trump. And his racist following that comes right after. So I stand with you, and I applaud you, Hilda. You're doing an amazing job in representing the API community in your district, and we're following your lead, and anything we can continue to do to stand together, please count on that.
Thank you. Wow, that's tremendous.
Well, that's all the time we have here tonight. I want to thank you both so much for all the work you're both doing in our communities and in the city and the county overall. Thank you for being with us tonight, and have a lovely evening.
Pleasure.
Thank you so much.
Bye.
Thank